London has declared a major incident as hospitals and emergency centres across the capital struggle to cope with coronavirus admissions. Well, I'm joined now by the London Mayor Sadiq Khan. A very good afternoon to you. Just how bad is it in the capital?
Good afternoon. The virus is out of control. The NHS is at risk of being overwhelmed. What I mean by that is that we're at risk of the NHS hospitals running out of beds over the course of the next couple of weeks if the virus continues to spread and people continue to be hospitalised. You'll be aware that across the country, on average, 1 out of 50 people have this virus. In London, on average, it's 1 out of 30. In parts of London, it's 1 out of 20. The ambulance service in London does an amazing job. On average, they would respond to 5,000 calls a day on a busy day. They're responding to between 8,000 and 9,000 calls a day. So we've already diverted some of our firefighters to drive ambulances. And over the course of the next few days, police officers will begin driving ambulances as well.
Londoners will have been used to seeing major incidents being announced during, for example, Grenfell and the London Bridge terror incident. What resources does that level of status bring to the capital? We know that we've got the Nightingale Hospital on ice, if you like, with spare capacity there. Is that going to be enough, or are hospitals going to need rapid action to help the capital cope?
We have a situation in London where the numbers of patients in our hospitals with COVID is 35% more now than it was during the peak in spring. Yet the restrictions in London are less serious now than they were in spring. So there is a number of things we've got to do. Firstly, I'm calling on the Prime Minister, and I've written to Boris Johnson earlier today, to stop, for example, collective acts of worship in London, which can still occur. I deliberately missed Friday prayers today, but Friday prayers are still taking place. Churches, gurdwaras, temples are still open. Also, it's really important that we accelerate the rollout of the vaccine in those parts of London where the virus is spreading incredibly fast. We also need to make sure that we provide additional financial support to those Londoners who need to self-isolate. We've got this ridiculous situation where Londoners who should be self-isolating, because they're on a 0 hours contract that don't get sufficient support from the government, they're going out to work because they need to work to get money to put food on the table and a roof over their head, and are inadvertently either passing the virus on or cashing it. So we need a number of steps from the government to assist us, and me declaring a major incident, I'm hoping, makes it easier rather than harder. But secondly, it's a message to Londoners. You all need to understand this is serious. I've never been more concerned than I am now. The best way we can help our stressed, our strained and our stretched NHS staff and our hospitals is by staying at home unless you have a good reason to leave. And if you do have to leave home, please wear a face mask.
And just to give our viewers a sense of how bad it is in the hospitals, we understand that the numbers of people on ventilators has doubled since Christmas Day.
Yeah, I'm sorry to bombard you with numbers, but it's important to get across the seriousness of things in our city. So we've seen a 30% increase in general and acute admissions over the course of the last week. And we've seen a 47% increase of those who require a ventilator. Think about ICUs or high dependency units. The good news is we've made huge progress since spring in relation to treating COVID patients. But with this new strain now, we're seeing younger Londoners being hospitalised and having to receive ventilator care. What we can't do overnight is invent new doctors, new nurses, new health workers, new porters, new cleaners, new engineers. It's the same number of staff working incredibly hard. And say this, I speak to NHS staff on a daily basis, often more than once a day. They're stressed, they're strained, they're heroic. Many of them are traumatised by what they're seeing. I've been told it's like being in a theatre of war. And that's why it's so important that we understand the simplest thing we can do, the easiest way to help those amazing staff is by staying at home unless we've got a good reason to leave. And if we do, wear a face mask.
As you mentioned, we are getting better at treating COVID-19. The Prime Minister announcing those two new medicines used traditionally in arthritis as being absolutely critical in helping people to survive it. But that, conversely, increases pressure on beds in the hospitals. We're also seeing hospitals incredibly reluctant to release patients back into care homes. And it's all part of the problem as well, isn't it?
Well, I would have declared a major incident if I wasn't concerned. It's unusual for a mayor to declare a major incident across a city, but this is a pan-London crisis. What's unprecedented is the duration of this crisis. Grenfell Tower was awful. Terrorist attacks in previous years have been awful, but they've been relatively short incidents compared to this awful pandemic. And what I think we're seeing is a combination of these additional pressures placed on every single part of our society in London, whether it's hospitals, whether it's the ambulance service, whether it's the fire service, the police service, care homes, or those who would normally be going to work and be contributing to our economy. It's really important we all understand this is serious. It's the most serious it's been. And unless we reduce the virus spreading, the NHS will run out of beds.
Are people who need hospital treatment in the capital but not from COVID safe?
You raise a really important point. One of the lessons we've learned from spring is many non-COVID patients who should have received treatment from the NHS, think of serious cancer patients or those with serious heart issues, didn't call the hospitals or 999 or the NHS because they thought the sensible thing to do was to allow others to receive the care, or they were scared. My message to those patients who need urgent emergency care is please do ring 999. The NHS will treat you. It's really important we don't make the same situation, we don't have the same situation we saw in spring occurring now. And so the NHS does have headroom to treat those patients who need emergency care. But for others, please go to the 111 website or ring 111 or your GP. We need to make sure our hospitals are treating those who need emergency care.
We've seen another vaccine being approved for use here in the UK today. Of course, welcome news. The big fear is that there could be another mutation. In fact, it is expected by epidemiologists at some point in the future. Of course, we'll need to ensure that our vaccines are able to protect us from any variation. Lots of concerns about this variant coming from South Africa. The government introducing these pre-departure negative COVID tests. Do you welcome them, or do you think that there should be a test on arrival? We've got two major airports here in the capital.
You know, it beggars belief that things I was calling for in April are only happening now and don't go far enough. What needs to happen is what happens in other countries who've been more effective at getting a grip with this pandemic. Yes, a negative test before you leave your country that you're embarking from, but also we need to make sure when you land in our country that you don't have this virus, and we need to make sure that anybody who does come to our country is self-isolating, quarantining for a period of time, because it's possible to catch the virus after the negative test from the country you're leaving. It beggars belief that we're now 10 months on and we're bringing forward these measures which don't go far enough. And it's really important our government understands well, actually the health of individuals is linked with the health of our economy. The longer it takes us to get a grip with the health consequences of this pandemic, the longer it will take us to address the economic consequences of the pandemic as well. And it beggars belief that still, we're now in January 2021, nobody in government appreciates the way these two things are inextricably linked.
OK, Mr. Khan, a final thought for you. We had our first Help for Heroes clap last night, clap for heroes, I should say, last night. We're about to speak to an intensive care doctor. What would your message be to doctors up and down the country on the front line treating people with COVID-19?
A more effective way to help the NHS, rather than clapping for carers, is to stay home. I want to say to everyone who works in the NHS, I'm so grateful. We as a city are so grateful for what you do. You've gone above and beyond. We have nothing but admiration for you. Members of my family who work in the NHS, they've told me about the strains, the stresses that they are under. I'm afraid the bad news is we need you to continue to go above and beyond for the foreseeable future. I promise you, I'll continue to try and persuade Londoners to support you by staying at home. And if they have to leave home, to wear a face mask. And my promise to you also is I'll continue to lobby the government to do right by you.
OK, Mayor Sadiq Khan, who's just declared that major incident in London, thanks very much indeed for your time this afternoon.